A patient, who weighs 200 pounds, has a prescription for a dopamine drip at 5 microgram per kilogram per minute. There is 400 milligrams per 500 milliliters D5W on hand. How many milliliters of infusion does the nurse have to administer to the patient each hour? A. 17. B. 24. C. 34. D. 44. Answer is C. 34. Weight of patient in kgs equals 200 over 2.2 equals 90.7 kg dopamine to be given per minute equals 90.7 multiplied by 5 microgram per minute dopamine to be given per hour equals 90.7 multiplied by 5 multiplied by 60 equals 27,210 micrograms per hour equals 27,210 over 1000 milligrams per hour equals 27.21 milligrams per hour. 400 milligrams of dopamine is there in 500 milliliters of D5, so 1 milligram of dopamine is there in 500 over 400 ml of D5, so to give 27.21 milligrams per hour, we need to give equals 500 over 400 times 27.21 equals 34 milliliters. A patient is to get an MRI of the abdomen. Which of the following instructions should the nurse give the patient? A. Do not wear metal objects during the MRI, including jewelry. B. Do not take oral medications up to 12 hours after the MRI. C. Do not urinate prior to the MRI. D. Do not eat solid foods 12 hours prior to the MRI. Answer is A. Do not wear metal objects during the MRI, including jewelry. Metal objects should not be used near an MRI. An MRI, or magnetic resonance imaging device, will not function properly when magnetic objects, such as jewelry, are nearby, and can cause harm to the patient through the MRI pulling the objects away from the patient. Patients should be assessed for metal materials within the body as well, such as joint replacement or spinal hardware. Unless otherwise instructed, it is safe for a patient to take oral medications, eat solid foods, and urinate as usual prior to getting an MRI or following an MRI. Which of the following symptoms would support a diagnosis of Crohn's disease? A. Fatigue and headache. B. Rectal cramping and bleeding. C. Stomach swelling and gas. D. All of the above. Answer is B. Rectal cramping and bleeding. Rectal cramping and bleeding would be the most consistent in supporting a diagnosis of Crohn's disease. While it is unclear what causes Crohn's disease, patients almost always present with these symptoms. Fatigue and headaches could result following blood loss and Crohn's disease but would not be used to make a definitive diagnosis. People with Crohn's disease may experience stomach swelling and gas. These are also symptoms of all types of IBD. They would not necessarily be used to make a diagnosis as these symptoms are present in many other intestinal-related diseases. A nurse is teaching a staff seminar on patient confidentiality. Which of the following statements would be included in the presentation? A. Verbal consent is sufficient to allow family members to see a patient's medical records. B. If a family member is at the hospital, he or she would be entitled to an update on the patient's status. C. All hospital staff may have access to a patient's medical records. D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Answer is D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Consent to disclosure is implied in the transfer from one health provider to another for continuity of care under HIPAA laws as long as the facility members receiving the patient health information, or PHI, are directly involved in the care of the patient. Consent must be in writing from the patient to allow the family members to see the patient's medical record or receive information from care providers. Updates on the patient's status should only be given with consent from the patient. This includes all family members, even a spouse. Under HIPAA laws, only staff operating in the direct care of the patient are allowed access to a patient's medical records. A patient has a prescription for Tylenol at 650 mg every 6 hours. A nurse only has 325 mg pills of Tylenol available. How many pills would be administered every 6 hours? A. 2. B. 3. C. 4. D. 5. Answer is A. 2. Strength at hand equals 325 mg. Dose required equals 650 mg. Tablets required equals 650 over 325 equals 2.